She's very happy all the time. She's gone through a lot for being barely 6 months old. She was having jaundice when she was a week after she was born. So then they started running tests, doing ultrasounds in her liver. They couldn't find her gallbladder, so that's how they diagnosed that she had biliary atresia.
So this particular patient was actually, it's a new referral that came from another hospital, and it was decided that she will be transferred to our hospital for escalation of care.
Yeah, it's heartbreaking knowing that she has to go through this because she's so young.
In our first encounter with the family, we try to answer as many questions as they have, provide the education, and understand the status of that child.
Once a patient is referred, the first thing we do is get their insurance and submit it to our financial coordinator group so that they can obtain a financial clearance. The patients and family will be meeting all the team members, including the hepatologist, transplant surgeon, transplant coordinator, child life specialist, dietitian, social worker, anesthesiologist, cardiologist, to do their own evaluation.
What happens is we get a referral, and it's either an outpatient or an inpatient referral, and they'll set up a time for me to go and speak with the family and do what they call a psychosocial assessment. And so that involves really off the bat, I am going to be talking to the family about some of the most personal parts of their life. And the reason for that is that allows me not only just to get to know the family, but it allows me to really figure out what are all the aspects of their life and what am I going to need to support them with as they go through the transplant journey.
The University Transplant Center here in San Antonio has both liver and kidney transplants for pediatric patients. Our pediatric transplant program is proud to be one of the highest volume kidney program in Texas. And our liver program for transplant is the only liver transplant program in South Texas. We serve Bexar County, and we go all the way to Central Texas, mostly around the Austin area, to care for patients in need of transplantation. We have outreach clinic in El Paso, Laredo, and the Edinburgh area, which is the Valley.
Emerson is 2.5. She was born with congenital nephrotic syndrome, which is a condition that pretty much attacked the filters in her kidneys, and it caused her to go into renal failure pretty quickly. She was diagnosed at 8 weeks old. By 5 months, we actually had to make the decision to remove both of her kidneys and start dialysis. It's hard. You have to really put yourself in like a whole different mindset before you come to the hospital. Otherwise, it's just going to eat you up because you wish that you could switch places with them and you can't.
Say hi to the doctors, Emmy.
So when our patients are referred for kidney transplantation and they're seen by the team for evaluation, my role is mainly to help explain the transplant care process after their surgery, including the hospital course, the important medications, and their longer-term treatment course when they leave the hospital and so forth. One of the most important things I think will help our patients and their parents is maintaining good lines of communication, letting us know in real time if a problem arises with their treatments so that we can help keep them out of the ER or the hospital and give them the best chance to get to transplant.
They've been nothing short of amazing. They answer any questions, all questions. They even give you information that you may not even know that you were thinking about, asking questions for. They take it one step at a time.
We want to become an extended part of your family. We make sure they know that it's safe to come to us with any concern they have. I can help you with gas, I can help you with groceries. And remember, I told you it was going to be hard to ask, but I'm going to ask you. I really feel like that's what we create, is this extended piece of their family where they start to trust us.
I'm really glad that we're there because I don't know how things would have been if we were somewhere else.